Okay, so we'll move into, I'll just share a little bit about a global overview on mental health and psychosocial support in the current day and age, and then we'll move into the survey finding presentation. So I wanted to highlight something that I'm not sure if everyone has their mind set on. So last year around this time, you could read in the Global Humanitarian Overview from OCHA that people in need of humanitarian assistance was 305 million globally. Generally, this figure has been rising over the last number of years, and we have no indication that that number should be declining. And in spite of that, the Global Humanitarian Overview for 2026 talks about 239 million people in need of humanitarian assistance in 50 countries. And that's really a bit scary to me because it means that we have a lot of people that are not accounted for as needing humanitarian assistance. And that has been a decision of the Humanitarian Coordination, Office of Coordination, to actually, because of the funding cuts that happened last year and happened in many different levels and by many different actors, we don't have funding to support people in need. And we know that most of these people who are affected by conflict, climate, disasters of all different kinds, they are also suffering to their mental health and their psychosocial well-being. So it is really, really important that from the Nordic countries that we don't just settle for the fact that the list below, the policy changes has really been coming one after another, year on year. And we see a good momentum for supporting mental health and psychosocial support from different actors. Just to say, the Red Cross Red Crescent resolution from 2019, then followed by recommitment in 2024. We had the first UN resolution on MHPSS in 23. The World Health Assembly had a resolution on MHPSS and emergencies in 24. And then last year was the very big year for mental health, where the UN General Assembly had a declaration, well, it was approved a bit later, but it was approved on non-communicable diseases and mental health. And then very recently in March, actually, the Human Rights Council also approved a resolution on mental health and human rights. So we see many good developments, and all of these are encouraging member states to do better on mental health and well-being. But we see a big gap in terms of the support available and a huge increase in terms of the people needing assistance. All right, so what did our survey find? We had 96 respondents across the 4 sections, the generic one and the 3 thematic tracks. We had people responding from several different kinds of actors, and let me show you the respondent profile. So the primary respondent, approximately 2/3, were NGOs. And then we had international NGOs making up half of that, 2/3, and local NGOs, the other half of the 2/3. And then at declining numbers, we had academics and researchers at 10%, UN and multilateral actors at 10%, and donors and governments, and some additional ones at 14%. And we chose also to ask kind of what region are you focusing on? So you might be sitting in the Nordic region, but focusing in another, or focusing your work where you're at. And in that overview, we could find that half of the respondents were from Nordic countries and Europe. And then we had significant representation from Africa and the Middle East in the remainder, and also some from South Asia, and then a number who were globally and kind of multi-region focused. So it is not covering all the world, but it is covering a fair bit of it, I'd say. So with that in mind, we did some thematic analysis across the whole survey. For those who took it, you might recall that there was quite a lot of tick box exercises there, but we also had some open text questions. And throughout the whole, what we have drawn is that on the general side, the need for sustained funding, the improving and increased investment in localization efforts, doing advocacy as a Nordic bloc, integrating MHPSS across systems, and also not forgetting protracted crises were a few of the key themes that really came out. Across innovation, it was task shifting, community peers, so supporting communities across peers, digital innovation, an important feature, education-based psychosocial support, and caregiver-focused innovation. You will be listen up now, because you'll be discussing all of these in the breakout sessions later. For climate and nature, the key themes that came across were that it often operates in sector silos. There's a need for improvement in policy and governance. We can see financing failures in this area, some promising potentials for school-based disaster risk reduction and nature-based psychosocial support. And then lastly, in the children and education theme, we could see the risk of tokenism and power not being shifted when it comes to engaging children and young people, and adult dominance. So basically, many times it is adults who decide what should or should not be done, not engaging children and young people at all. We have issues around stigma and literacy, the understanding of your own mental health and what is needed to support it. Here again, we can see the caregiver focus came up strongly, and then child participation specifically. Lastly, we have some cross-cutting themes coming out across the whole survey, which again, sustained funding, localization, caregiver support, and cross-sector work and child participation. So a couple of different axes in terms of that. Now, one question we had was, what has changed since the last conference? So in the global landscape, we could see respondents really highlighting the increased conflicts and displacement, and with that also the escalating demands of MHPSS services, government budget cuts, and less predictable funding, as well as climate crisis increasing mental health needs, but also a greater political attention to MHPSS. The priorities and key barriers, let me start with the barriers that came out, was no surprise, lack of funding and funding uncertainty. That was very much like a staple that stood out as a top barrier by wide margin. Then also an insufficient trained workforce for mental health and psychosocial support, a lack of political will and leadership in some instances. So some of the urgent priorities that came out then was collective advocacy for stable and long-term funding, expanding services to meet the escalating demand, and supporting and protecting frontline staff as a separate and also very important priority. When we checked across which phase of emergency, people would find that MHPSS needs are the greatest in their context that they would be reporting from. We could see that preparedness was the least, also not surprising. Acute emergency phase second, long-term recovery third, but actually the highest and greatest need, often overlooked in media attention and funding, is the ongoing and protracted crises. Not to say the least that many times it's in the ongoing and protracted crisis you might have new and acute crisis happening in addition to that. So when we asked about what are your top 3 priorities, and I believe that was the open text question, participants across all 100 identified 3 critical priorities for the sector, with the first one, the highest one, being localization and shifting power, including youth participation and leadership. The second one was the need for finding pathways that scale promising practice and evidence practice in combination with system integration, of course. And then lastly, to really look at having responsive mental health and psychosocial support interventions for the climate change and the climate crisis that is ongoing. Now, we also asked what will be the one most important actor for Nordic actors, important action for Nordic actors. And they came out along the same themes. So commit to funding, sustainable, flexible, multi-year and pooled funding for MHPSS. Shift the power to local, shift both resources and decision-making to local and community-based organization. Really champion MHPSS using Nordic diplomatic capital in international fora, so UN and EU level, when the Nordic countries come together, they can actually have a bigger voice than they would have individually. And then, of course, embed MHPSS into national health, education, and social protection system from the beginning, because if they're there from the beginning, then it won't be as hard to rebuild them in case of an emergency or a disaster. And that was the generic part. I'm going to hand over to Maria. Just let me know when I should shift your slide.
Thank you, Marie. So if you recall, we had 3 separate thematics then for deep dives, reflecting then the tracks for the conference. It will be innovation, climate and nature, and then children and education. So for innovation, first of all, I'll focus on what was deemed to, we asked, which sort of innovation has the highest transformation potential. So first then was community co-design models for system transformation potential, then followed by innovative implementation strategies, and then digital delivery platforms. Then when it comes to what do respondents then consider the largest barriers to scaling innovation, then as you see here, it was funding risk aversion was identified as the biggest barrier to scaling MHPSS innovation. And other significant barriers then was workforce capacity constraints, infrastructure gaps, and institutional resistance in some cases. Thanks, Marie. Next. Then when it comes to where would digital innovations or digital tools add most value, respondents then saw the greatest value in remote service delivery, followed by workforce training and supervision and quality assurance. And then for innovations ready to scale, the most cited scaling success was task shifting, and the MHGAP-based models from WHO was the most cited as scaling success, followed then by community-based peer support models, digital and remote innovation, really stemming out of COVID-19 as a sort of massive impetus to innovate, which then has continued since then. What was mostly brought up then was phone-based counseling, app-mediated interventions, as well as using digital for screening and follow-up. And last but not least, education-based programs. Next. Thank you. So for climate and nature, what in terms of fastest growing climate MHPSS challenges, there was 2 which were without a doubt the most selected, and that was one, livelihood stress. So roughly 2/3 of respondents cited this as the most major challenge, closely followed then by displacement-related grief, where again, roughly 2/3 of respondents selected that as one of the key climate MHPSS challenges. When it comes to most promising intervention types, then the most cited was really livelihood plus psychosocial models together, followed by disaster preparedness integrated with MHPSS. So really then in terms of beneficiaries, really getting both the disaster risk and resilience together with MHPSS. And closely then followed third by nature-based approaches and also indigenous knowledge integration, whereby local communities really already have that indigenous knowledge. And so we don't need to come in with anything new. How can we support and strengthen the community through those practices? Thanks, Marie. When it came to most scalable climate MHPSS interventions, then it was school-based disaster risk reduction was the most frequently cited. I think I just mentioned really valued for integration into existing education systems with the dual benefit of both building disaster preparedness and psychosocial resilience. Then it was also livelihood psychosocial integration models, and then disaster preparedness with embedded MHPSS as the most scalable interventions to focus on, as well as, of course, nature-based approaches being one of the most scalable and also one of the most low-cost approaches to scale. Thanks, Marie. Moving last but not least into children and education, then when it came to what were the biggest threats to children's mental health, the most cited was protection risks, including violence against children and child recruitment, caregiver stress, very much linking to children's mental health and well-being, and loss of safe spaces. High impact interventions that were cited to tackle these threats then was social and emotional learning, parenting, caregiver support, or sort of two-generational support within that, also early childhood development and play-based healing. Thank you. Deep diving into barriers to scaling child-focused interventions, then of course, a running theme, financing limitations, was the most frequently selected barrier for child-focused MHPSS, followed then by workforce training gaps, including supervision. So it really is a shortage in workforce capacity in trained personnel and adequate supervision, hindering program expansion and scale. Then poor coordination across sectors, so a lack of integrated approaches across key child-serving sectors, education, protection, and health systems. And then also education systems capacity constraints, so limited resources and infrastructure within educational settings are impacting and limiting delivery. Thanks, Marie. We also then had a separate section as part of a meaningful child and youth participation. And here, these are sort of the main barriers that were brought up. And understanding these barriers is really crucial for fostering ultimately genuine engagement and empowerment of children and youth in decision-making processes. So tokenism, in terms of children being consulted, but no meaningful and genuine decision-making power being given to them. Then misuse safeguarding. So safeguarding concerns were highlighted, sometimes being used to restrict rather than enable participation. A low MHPSS literacy among caregivers and decision makers, hindering understanding and support, and thereby, of course, meaningful child and youth participation. Adult-driven systems and institutional risk aversion, limiting involvement. Stigma, still, of course, associated with MHPSS issues, can deter participation in a lot of contexts. And again, short-term funding, so short-term donor cycles, don't build in participation from the outset. That's really restricting then the long-term impact of any program that's coming in. And I'll pass to Marie for the end, but just one thing I want to highlight with everything that we've presented so far is really that the intention and goal for the conference and the recommendations coming out is really to guide all actors, both Nordic actors, but also everyone more globally that are taking part in this process when it comes to using the document with your respective governments and donors and key stakeholders in your context when it comes to guiding their actions and commitments for MHPSS in before, during, and after emergencies. So over to Marie for rounding up. Thank you.
Thank you so much, Maria. I hope we're doing a good job of not kind of being too lengthy, but that's the gist of the survey results and the key takeaways. Just in summary here: funding and political will are critical barriers, whilst localization and shifting power to local actors is essential. System integration and coordination are needed across sectors to reach everyone. Innovation in digital tools offers promising pathways, and caregiver and community well-being is foundational, and also to have that as a focus, with caregivers being the first respondent to all children's needs. So let's just give it one more second and we'll come to the last part and the wrap up of today. I hope you sometime throughout the whole had a chance to do a nature break or get a coffee. I realized we didn't book in a break, but it's like when you're at school, right? Do your break while you're doing your breakout.
At least it was a great engagement, I think. It was a rough start in the beginning, but then it worked through eventually.
Good. That's why we decided to do one long breakout, so people really had a chance to land where they needed to be. All good?
Yes.
Yes. Thank you, Maya. All right. So I hope you had interesting times. We've been watching the Miro board and just amazed by all the activity from here. So thank you so much all for your contributions. So we're going to go through briefly. I'm going to try to do, with the help of my background helping hand, Latena, who have looked across all the 5. In the end, we had one group that merged into one, so we have had 5 groups. And I'll share a bit about the generic outcomes, and then I'll call upon each of one person from each thematic group to share some input. So starting under the theme of sustained funding, we had a number of calls for what we've heard. So confirming flexible and long-term funding needed that supports integration, community ownership, and scale up. That the funding also goes to multi-sectoral and intersectoral approaches, that it funds locally led approaches as they're often cost effective. Also a proposition to create a large multi-institutional pooled fund to support MHPSS response across different needs and contexts. I'm not sure what you think about there, but Education Cannot Wait comes to mind, because that's one big pooled fund for education. Very interesting. Moving to the next theme, that was localization and shifting power and resources to local and community-based organizations. Here, it was lifted the need for enabling leadership of local communities, including people with lived experience of mental health conditions and distress, including children and youth voices, in the design of both intervention, in both the design and the implementation of the interventions. A call for equitable partnerships and flexible funding arrangements between international and local organizations. I think that is a sticking point that we're still working to address, because we all know that the bigger organizations usually get the funding and then the local get it last. So an important point there. Another point under localization was to ensure that training and capacity strengthening is there to enable long-term impact and to support Indigenous rights and land-based approaches, especially for climate action. Now, under Nordic advocacy, we had some interesting points where the group in total was pointing towards letting the Nordic actors advocate for integrated and human rights-based approaches to kind of really champion that, and to ensure then that long-term funding includes recovery and rebuilding. There was also a point there, I believe, on peace building. Also a suggestion that for advocacy, we would spotlight the need for access to whatever is needed, medication therapy, as well as psychosocial interventions, and acknowledge the need to speak more about the need for climate action in Nordic advocacy. Okay. And the last one on that one is to advocate for increased funding also for gender and racial and other minority groups affected by the global funding cuts. Now, for system integration and cross-sectoral work, there were a few points raised on the need to integrate into school-based programs that are accessible and scalable, to link MHPSS and climate more closely together, both by doing research and developing evidence-based interventions. For those who work in this space, we know that there might be some research coming out more needed, but there's really a lack of evidence-based interventions for climate and MHPSS. And then we have donors, an action that donors should fund evidence generation to support and strengthen this system integration for in general, and policymakers to ensure that their countries have national policies for MHPSS. One document actually that I didn't highlight, but I can do it now, is that it's a pretty big breakthrough that I believe it was last year, WHO, they released this guidance for governments on how they should ensure that mental health is integrated across their different sectoral policies, national policies. So that goes in line with this recommendation. Now, we also looked at the other box on a number of suggestions that had been put in there on if there's something that's really important not to forget, because we know that these 4 that we had selected was based on the survey and there were more themes there. I saw a pretty key analysis, what can you say, a summary of what came out in the other boxes across the 5 groups. And it was really around bridging gaps. So between research and practice, between practice and policy, between kind of the academics and the NGOs and the health practitioners, as well as with the civil society organizations and the advocates. So a number of comments have been made along those lines, which is obviously really important, always challenging. And some of the outcomes for that would be to then, by bridging those different kinds of actors, creating more accessible, translated, and actionable knowledge sharing, and potentially centralized knowledge sharing as well. Another theme that came out was the need for more evidence, to build more evidence on what works across these different actors, to ensure that documentation and data doesn't get lost now with the funding cuts, and invest simply on further research and evidence. Yeah. One little outlier that I wanted to mention also was to strengthen linkages with transitional justice actors, active both in local and multilateral bodies. Right, so that was a quick summary of the generic discussions. Thank you so much for all your inputs. Before I hand it over to Maria can go first, I just want to say that all of the inputs will be looked at more in detail. So this is just a quick glimpse of what we got because we wanted to give that back to you straight away. Okay, so Maria, a few words from you, and then Tanya can go next, and then Monette.
Thank you, Marie, and thank you for the great engagement in my group. Much appreciated. So we were looking at innovation and really honing in on what are the sort of fundamental key barriers to scaling the most promising approaches that came out of the survey. And similar to the general section, then there was a big emphasis on how, when designing from the outset, new or indeed any solution or implementing, that we have sustainability in mind. So really including the co-design with local communities and local stakeholders, as well as national governments, and building the local ecosystem in the sense of strengthening local systems and local actors to ensure and sustain local implementation and continued iteration with a view to moving to acceleration and transition to scale for the most promising approaches, in parallel with building out national fundraising strategies to again tackle that project-based funding that we are sort of privy to in the sector. So looking really at more the long-term robustness of any innovation that is showing strong promise to be able to then actually scale in practice over the long term and be sustained by local communities. And keeping in mind as well with the underlying issues that need to be tackled together with MHPSS. So there, climate and nature, for example, or alcohol issues, and so on. for the long-term sustainability interlinking challenges need to be addressed together. There was a lot more that came out, but I'll stop there and pass it then over to Tanya. Thank you so much.
Thank you, Maria. And thank you for the group who discussed MHPSS and climate and nature, probably mostly climate. Just a few words on it. In our group, it was mostly mentioned and discussed how although climate people and MHS people are each other's allies, and there is a very clear wish to work together, and everyone sees the need to work together, there often is still siloed work. And it's even though you have this foundation of willingness, there are not enough tangible evidence to actually do it in practice. So there's a huge barrier in terms of how to move it forward or how to take the next steps. And this is also where the continuous silo work comes in. So this was discussed also with different examples from the group of how it was experienced in different organizations and parts of the world. I'm not sure I want to say much more than that. I think when it comes to climate and nature efforts, an inclusion of MHPSS or inclusion of MHPSS into climate is still very much in an early phase, and it's very, very clear again that there's a huge wish and interest in this, but we still need to come together and sit down and actually look at then how do we overcome these barriers. So I think from the great group discussions, we'll be able to take forward some recommendations that would try to. Thank you. Over.
Yeah, so in the education track, we looked at the difficulties that there is now in fragile setting with so many refugees. The schools are occupied by refugees, basically. That's a huge barrier for doing something. In addition, the easiest way to scale would be to help teachers. Those are the ones close to children. Those are the core foundation. And also the other adults around. So if more focus can be on that would be of help. I think the core of what we felt like was emphasis should be on the teachers. That would help, and the parents and the adults around. That would help with encouragement of the children's participation and youth participations and so forth. That would help the society, even in places where you lack systems for referral. In many places, you even lack professional people. Then also, schools should be safe places. That is more and more used as, like I just said, refugee places, and schools are targeting and so forth. To focus more, this is a barrier that schools are not safe for anything. And then, of course, we talked about the synergies. Very many, like the others have said in the other groups, there are people working in silos, there are intentions of working together, but we're still sticking to our core theme and our core work, and more would probably amplify if more cooperation between health, between protection, between safety and so forth would be more in action. I think that was it. There's a lot more also, but I guess that'll come in when everything has been put together. Thank you.
Thank you so much to all of you for sharing a glimpse of the discussions across the different breakout groups. So just to share a bit about, as we wrap up today, the next steps. We're very happy to have had 67 participants at most, and then almost 50 actually all engaging across the breakout groups. Now, I'm the coordinator of the Open Pledge Working Group that has been meeting since last summer to slowly get to this point. And we also have the 3 track leads in the Open Pledge group. And each of the tracks has a planning group as well that helped to review all the abstracts that were submitted for the conference and so on and so forth. There's a lot of volunteer time that goes into this. So we will take the outcomes of all these discussions, the survey, these workshops, and look at drafting recommendations based on the inputs. So what happens here after is that we now have a slide deck with a summary of the survey. There will be a recording, and also a bit further down the line before the conference, there will be draft recommendations. So we'll share what we have now post-event, and we'll also be sharing the draft recommendations a little bit further and closer to the date of the conference, perhaps even with the chance to give final input. We haven't discussed that in detail yet, so bear with us as we come back to you. But it's been such a privilege and a joy to see all of you engaging. And on behalf of the Nordic MHPSS Network Steering Committee and the Open Pledge Group and the track leads in it, thank you so much, everyone. Let's press on. There is good reason, and there's a lot of people that depend on it.